Welcome to my channel. My name is Danielle, also Bent Loves Love, and I'm coming up here with a story time. So, I've been an LPN for 5 years. October 19th made 5 years, and I'm grateful, but I didn't set any clear intentions for this career. I just knew I wanted to be a nurse. And I recently was called by state. Now, if you know anything about state and working in the healthcare field, those are the people that you want to impress, or a facility wants to impress when they come around to do their rounds, right? They go to different nursing homes and they go through different cases and they ask nurses and CNAs certain questions that they should know the answer to. And, you know, they give citations, they give violations, and all that type of stuff, right? Your administrator wants you to be on your P's and Q's on this day when they're coming around because, they want A's. They want nothing but A's this day, right? But there's some facilities that, like, it's just not working together. So I was called by state in, I want to say, June, July, around that time. And I think I had just come off a double. I was knocked out, and my phone rings, and she's like, "Is this Danielle, such and such?" And I'm like, "Who's asking?" And she's like, "My name is such and such with state. Um, want to ask you a few questions about an incident that happened at such and such nursing home. Um, about sometime last year." So when she called me in September, this incident had happened in 2024, maybe around September-ish, between September and December. I'm not sure exactly what month it was, but when she said the incident, I was like, "Oh my, yes, I do remember." So what happened on this particular day? You come onto the unit, and I just want to say this one thing: your CNAs could make or break you, right? So I'm fortunate enough to have worked with CNAs that know the residents and are very genuine to let another CNA know what the vibes are. They don't want you doing anything by yourself. They make sure they tell you that if a resident is two assists, don't go and be one assist, right? If they tell you we're going to do all these patients and put them in bed, they're going to do it together, right? I've seen CNAs that as soon as they get on the unit, they make sure they put whoever they need into the bed together, and then they're off to the races solo, right? They work in teamwork, and then they work solo, right? So this particular day, I've come onto the unit, and I have two regulars and one agency, or maybe she's new, whatever. And they told her, "Such and such is two assists, such and such is one assist. This patient you don't have to touch. This patient, all you need to do is give a pull up," or whatever the case may be. They told her brick by brick by brick by brick. And one thing for me when it comes to new CNAs standing in front of me, if you need help, let me know. I don't mind. I don't mind locking up my med card. I don't mind stopping whatever I'm doing. I don't mind. Get yourself prepared. I'm coming. If I see you pulling a Hoyer lift, I'm coming. If I see you pulling a Hoyer lift, and I don't know where everybody else is at, do you need help? Whatever the case may be, because I'm that type of nurse, right? So, um, this CNA comes back to me. Maybe it's 3 p.m. I started the shift. Maybe between that time and 5, the patient's on the floor. And I'm like, "Why?" Why is the patient on the floor? Oh, I went to go change her and she fell out the bed. But they told you she's a two assist. They told you this particular patient is a two assist. She has surgery on her leg. She's very fragile. And you did her for so long? Oh, she was acting so dramatic and this, that, and the third. When I told her to turn over, she didn't want to hold on it because you were not supposed to do her solo. Okay. Now everybody's coming upstairs now because I have a patient on the floor. Mind you, it's about 30, I want to say 36 to 38 residents. Sometimes I don't even know how many residents there are. I just know head check. Like, I don't even count. Like, Mrs. Such and such is there, Mrs. Such is, you know what I mean? A, B, you know what I mean? I just know off rip, but I never know the quantity or whatever, right? And I got to take care of the rest of the patients, right? So now we got this patient on the floor. Everybody's being neglected now because this resident is on the floor. How are we going to get her back into the bed? Because now she's on the floor hooting and hollering. The leg looks like it's shortening. We got to send her to the hospital and all this type of stuff. Mind you, she just had surgery on this leg. Like, the fuck were you thinking, my girl? In my mind. I didn't say it in my mind. So they end up sending that CNA home because she didn't listen, right? You didn't listen. I know you came here to make your money, but there's a proper way to make your money. And everybody said we on deck on teamwork, and you decided to do this solo. You could have asked the nurse because the nurse had extended herself to you. The CNAs may not have been around to help you at that moment. You could have asked the nurse, and the nurse told you she would have locked down everything to come and help you. So now we pull her up, hospital, ambulance gotta come and get her and stuff like that. They send that CNA home. Paperwork is done, everything is done and out the way now, right? Time is ticking. I go away to Mexico and I come back and I go through life and all this other stuff and June, July hit. It's state. Do you remember that case? And I'm like, yeah. So she asked me a couple questions. I don't remember exactly what the questions were, but I know it was on along the line of did we explain to her? And I'm like, I was sitting right there. Them CNAs told her exactly what the vibes were. And I'm talking to her just like this because I'm just like, I ain't scared of nobody. I'm not afraid of nobody. And then I say to her, I mean, she was being a Speedy Gonzalez. She could have asked for help or she could have waited to get assistance with this resident, but she didn't. And this is what I mean by sometimes the CNAs put you in really tight predicaments because it's like, had you just waited, had you just gone to somebody else, or had you come and asked me, because she didn't come and ask me anything, um, this would not have happened, right? And sometimes as I'm hearing this situation about the CNA who just got the negligence, um, criminal negligence homicide planted on her name. Um, there's a lot of CNAs talking about how there's not enough staff and how CNAs that are there don't want to help them and how the nurse doesn't want to help and all these other things and stuff like that. Listen, it it only takes a minute for you to get help with the Hoyle. If that person wants to have attitude, let them have attitude after that patient's butt is on the bed, right? So the lady chuckled when I said Speedy Gonzalez because that's exactly what happened. She probably wanted to get her shit done so that she can go and sit down in a corner somewhere and not have to worry about her patients for a couple hours or whatever the case may be. And look what happened. Now you have a case pending, right? So now at that point, it's like state was just accumulating evidence for this particular situation. So I want to say about 7 days ago, the facility called me again. It was like, oh, state called. Now there's a case pending, and there's a possibility that they can be calling you and stuff like that. And I was just like, the information is not going to change. She was a Speedy Gonzalez, and she took it upon herself to deal with this resident. Now the resident was on the floor, splat cow. Who knows how high the bed was at that moment, right? Who knows? Who knows what more damage? Who knows? You don't know if you fucked up her hip. You don't know if you shattered her femur. You don't know if you disrupted everything that the doctor just did because you decided to be a Speedy Gonzalez. Now you got a case pending. Family wants to sue the nursing home. And when I looked up how much nursing home cases can actually um, give, I don't know if it's defendant or plaintiff or whatever the case may be, it's up in the 100,000s. You know, it could be 400,000 plus. There's actually where I'm living right now. There's a nursing home lawyer firm out here, and I want to call and start asking questions about this so I can start coming up here and talking about it because negligence is big. And you wondering why y'all not getting paid because there's negligence everywhere. I just had to bark at a CNA about her negligence, and it's becoming redundant at this point because you went to school for this and you know what you're supposed to do, and I understand being short staffed, but if you have a productive, prudent nurse that understands that this ship, she has to be the captain, you can always come to the nurse and ask them for help if you need help. I tell all my CNAs, and my CNAs know, if you need help, come to me and ask me. If you short, if your CNA, if there's a CNA on break, you need help because the other CNA that's with you, she can't help you because she's doing another patient or something like that. Just ask for help. I make sure that I don't leave the floor, and if I do leave the floor, I make everybody aware that I'm leaving the floor. Right? Do you need something before I go? What's the vibe? Can I go on my break? And I be asking my CNAs, can I go on break right now? Because who knows what's going on at that moment? You know what I'm saying? And sometimes whatever these CNAs be going through and they bring it to work, that's a problem. You putting these patients in a crossfire because you're not in the right mindset. Who knows what was going on with Shorty in Louisiana when that patient flipped out of the. It just doesn't make sense to me. Like, did she put her in the Hoyer lift correctly for her to slip out of it? Like, what kind of Hoyer lift did they have? Because in the facility that I have, they have the ones that cross between the legs and clamps in and stuff like that. So, like, how did this patient flip or come out of the Hoyle? Like, I don't understand it. You know what I mean? So, me being called by state makes me really open my eyes now because it's like there's so many things that CNAs are doing that causes a problem. That's why in one of my shorts I said, like, I'm not going to be the nice nurse anymore because sometimes when the CNA does something, the nurse gets blamed as well. And I don't want to get blamed for anybody's negligence. You feel me? Like, I don't want that type of energy on my file as a LPN that I haven't been an LPN for the past 5 years and I have not, there's no marks on my record and I want to keep it that way. You feel me? So the CNAs, what I'm realizing, like, your CNAs could be your downfall, and state, I don't know what's going on with state, but state seems to be coming in with a whole fresh set of eyes and things that they've been, people, those workers that have been there for years, and they just glance over and they just push it to the side. State probably is like going into closed files and finding out what the issue is so that those certain issues don't happen again. The new eyes that are in state right now, state is not playing. When's the last time you heard of a case like that? You know, twice in Arizona, I've heard a patient has passed away from falling right before my shift. And I'm like, damn, that's madness to me, you know, because there's not enough staff to watch the one-on-one. There's not enough recreation to have these patients stimulated so that they can, not be chaotic in their system. Plus, a lot of patients are not getting bathed, so therefore they feel uneasy in their skin. There's a lot of things that are going on in these nursing homes that need to be really focal pointed, like laser pointed, looked at. There's certain things that I'm just like, just imagine if that was your relative, right? And because a lot of people will sit here, oh, that's not my relative, so I don't treat them bad and this, that, and the third. I don't want to do this and this. I had a situation with a CNA that I'm going to do another video about because um I'm tired. Like, I'm tired. I don't want no problems. I don't want anything because the moment I have to deal with a CNA causing my downfall, there's going to be a problem, right? And if you are a nurse, I advise you to please get malpractice insurance. To get I advise you to get malpractice insurance. Excuse me, because somebody is in here dying and coughing up a lung right now. And the only thing I could think about is Clorox. That's the only thing I could think about. But yeah, like if you are a licensed practical nurse, a registered nurse, an NP, make sure you have insurance. I don't know if CNAs have malpractice insurance, and I'm gonna check into that. But yeah, be careful. Okay, be careful. That girl that was in Louisiana and she got the criminal negligence on her record. When I looked at it, it's 10 years in jail or 5,000 like fine or something like that. And I don't know how good that fine is because the loved one has passed away, but you know, be careful. Be careful in healthcare now because whoever's in state right now and looking over notes and trying to find discrepancies and stuff like that to lock people up, clank clank, be careful. That's all I gotta say.